There's been an increase in legalization of euthanasia and assisted suicide in developed countries.
Both are legal in the Netherlands, Belgium, Luxembourg, Colombia, and Canada. Switzerland, along with 5 U.S. states, Oregon, Washington, Montana, Vermont, and California, offer physician-assisted suicide. Dr. Ezekiel Emanuel and his colleagues from the University of Pennsylvania reviewed all available data on these interventions from the late 1940s through 2016.
Public support for euthanasia and assisted suicide is quite interesting. It's more supportive of euthanasia. It increased from 1947 to about 1990 and then plateaued. And over the last few years, there's been about a 5 or 10% decline in support.
The study appears in JAMA, Journal of the American Medical Association. The interventions are rare. In the Netherlands and Belgium, less than 5% of all deaths are by assisted suicide or euthanasia. In Washington and Oregon, only 3 in 1,000 deaths are by assisted suicide. However, not every case is reported, so it's impossible to tell if these are true rates.
70 to 75% of the patients who get assisted suicide or euthanasia, no matter what the country, tend to be patients with cancer. It's people who really have sort of given up on life, or they fear the loss of autonomy and dignity.
They tend to be older, white, well-educated, and well-insured.
We know these aren't flawless procedures. We know that they have mistakes and complications. We just don't know the exact rate and the full nature of them. Worries about widespread abuse of these practices, that people who don't have insurance or poor people might be predominantly targeted, do not seem to be borne out by the data.
Dr. Emanuel also says these practices occur whether they are legal or not.
It behooves us to actually look at the practices and try to understand how they work, how well they work, what the problems are, before we rush to legalize it in a lot of other countries.
Catherine Dolph, TheJAMAReport.